Science and Technology Kerala, and I'll be moderating today's talk along with my co-host Swagatama, who is also a PhD scholar at MS University of Baroda, Gujarat. So today's special series talk is about imposter phenomenon, which is today's talk we will be having a discussion about imposter phenomenon in the academic population, and this talk will provide an overview of experiences highlighting those seen in academic settings, and it will discuss the possible causes and practical strategies to cope with the imposter syndrome. So before the talk, I would like to introduce the speaker. So today's speaker is Dr. Mayya Sundukova, who is a neurobiologist, narrative coach, and advocate for researcher well-being. She has been active in the system-level working group of Cost Action Researcher Mental Health Observatory and Dragonfly Mental Health Ambassadorship Program. As a resident fellow at OLS, which is an open science training organization, Dr. Sundukova aims to bring well-being education and interventions into the context of research teams and organizations. So with this introduction, before going on to the talk, I would remind the audience that after the talk, we will be having a Q&A session. So you can put up your questions in the chat box and it will be discussed after the session. So with that, I would request Dr. Mayya to start the talk.
Thank you so much for this warm introduction. Thanks everyone for choosing to spend the next hour with us with this talk. I do have some slides. I hope they do work. Yeah, I guess you can see them. So
yeah, it's
fantastic, thanks. While I'm in the full screen mode, I cannot read the chat really. So please feel free to interrupt me if you have urgent question or if there is something that needs my attention without any problem, all right? So I'm here today to present Dragonfly Mental Health and to speak about imposter phenomenon. I'm really glad to be coming back here in this community, the student network on extracellular vesicles, because last year I was giving a talk on burnout. We start with the disclaimer that this is an educational talk and a space for discussion from a peer perspective, as Dragonfly Mental Health is not a healthcare provider. Therefore, it doesn't substitute the speaking to medical professionals. And a reminder, if at any certain point you're in crisis and need help, please go to services that are available in your country, in your context, or in the case, if nothing is available, you can use the Samaritan.org or other helplines. And today will be, first I'll speak about my personal experience and introduce the Dragonfly Mental Health in the case that you are not familiar yet. Then we cover the basics of imposter phenomenon, highlight the specificity of academic environment in this phenomenon, and hope we can make a list of what can help based on what I will be sharing, or also taking inputs from you. So Dragonfly Mental Health is a non-profit organization based in US, and it has been founded almost a bit more than 4 years ago, and its motto is excellent mental health by academics for academics. It's based on volunteers, and currently there are more than 300 volunteers from 45 countries. And later I will explain you how you can, for example, join this organization. So I'm a STEM scientist. I'm a biophysicist and neurobiologist, as I was introduced. So I've been in academic system for more than 10 years. On the other hand, I have been developing skills and getting knowledge on how to help my peers, how to help myself in leading better life within academia. And being an ambassador for Dragonfly Mental Health was a big part of it. So I'm happy to give this kind of talks. So Dragonfly Mental Health does three things. It's does educational talks, such as on-campus in-person programs or virtual talks that focus on educating people on certain aspects of mental health in academia, training skills, or developing specific strategies and support for working with stigma related to mental health. And of course, it's also a community. It's people. There is Dragonfly Cafe Networking, which is a free virtual space for peer support and an excellent entry point if you want to know more and to be involved. But also Dragonfly Mental Health does research, understanding the scope, the causes and solutions, systemically, what can be done to improve our mental health. And this map shows the overall reach in terms of countries where the programs have been delivered. Some numbers are really impressive. More than 300 people reaching out, more than 45,000 in 22 countries. And I know this network is international, so with one talk, I guess we are reaching a couple of countries more, I hope. So coming to the imposter phenomenon. The term itself was described in 1978, quite some time ago, by two psychotherapists, Clowns and Emes, in New York. It was dealing with high-achieving women. Of course, they were with certain level of income. They were white, and it described, high-achieving people who, despite the objective success, could not really accept this accomplishment and were having doubt in themselves. Since then, the term has been also mentioned as syndrome, as a fraud syndrome. Academic literature also mentions perceived fraudulence, or calls it imposter experience. So this kind of talk that I'm giving, it's peer perspective. As I mentioned, I'm not a medical professional. So we rely on literature, academic literature, and the most recent systematic review was from Bravata et al. In 2020, which first of all, showed this new definition, stated that this syndrome, or as we will call it, phenomenon, it's not a recognized standalone psychiatric disorder. And we, in this talk, will highlight that the original study, as I mentioned, was really a very specific cohort of women in the New York. And of course, it lacked people of color, diversity in age, gender, and income. And at the end, we'll be, asking, is it something personal, or it's a natural response to discrimination that exists there in the society? I'm also a part of Researcher Mental Health Observatory, which is a research consortium on researcher mental health. And 2 years ago, Dara McMashin was giving a talk on imposter syndrome, and he highlighted that the language matters. And so if we call it a syndrome rather than phenomenon, then we bring this medicalization and unnecessary pathological interpretation to what may be an appropriate response to complex factors in the situation. So after the talk, we will be using the phenomenon word. And to have a little joke, we'll use the word prevalence, like medical doctors use the word prevalence, treating as if it is a disease. So how many people in certain type of group do experience the symptoms of this imposter phenomenon? So interestingly, a lot of doctors, like future doctors, they suffer from this imposter phenomenon. People who will go and treat us, Doctor Who. So according to different literature sources, up to 8% of medical and pharmacy students do perceive themselves as imposters. And in another research, between 22 and 60% of physicians in training. So basically, from 1/3 to more than a half, they do have this imposter phenomenon. So now coming back to the systematic review that I already mentioned, they looked at different prevalence rates in this phenomenon in different groups, and they report a huge variation between 9 and 82%. You should know, like a huge window, which depended on the screening tool and the cutoff used to assess symptoms. And what was important from that review, that the historically marginalized group had higher prevalence rate of this phenomenon. What was interesting is that, I mean, first people thought it's only about women who have imposter phenomenon, but in fact it has been found to be common also among men and also across different range of groups. So not only young, maybe less experienced people, but also late stage professionals who are expected, to know it all and have to be established in their professions. What is less nice is that imposter phenomenon is often comorbid with depression and anxiety, and is associated with worse job performance, less job satisfaction, and burnout. And of course, because of this complex nature of this phenomenon, it's difficult to even design a specific treatment, of treating a standalone phenomenon. There are some maybe studies on dealing with some symptoms associated, like specific ones, and we can talk about it later. So how this phenomenon can be manifested through experience? Well, you might have numerous diplomas, you can have colleagues that validate your professionalism, you might have a distinct position, praise of supervisors, but still not being truly believing in merits, and rather attributing the success, well, it was just luck, or it's happenstance, but no, it's not due to my talent or qualifications. And this feeling that they are deceiving people, this fear that it's just those people are not, they don't completely understand my work. That's why they think I'm good. So success, how does it, how it links to imposter phenomenon? The imposter phenomenon is characterized by feeling that the success, the one that is objective that I mentioned, if scrutinized well enough, would be found to be invalid, wrong, or even useless. Or as I mentioned, it's a result of accident that has not been earned or not deserved. For example, a thought might like this: oh, yes, I got into graduate school, but everyone else deserved to be here, and I in particular got in by mistake, just not because I studied hard and was and the thought that I'm here by accident and concomitant fear of being exposed, revealed as an imposter, leads to feelings of shame and damages the self-esteem. And self-esteem in such cases could become really unstable, depending on, on validation, on capability to always, demonstrate high achievements, and then it can create a vicious circle. So as I was mentioning, I have the right to be here, in this position and this community only if I am achieving. And the facade of the imposter phenomenon is that it creates the anxiety, that fear of shame constantly feeling the person, this feeling of being exposed, the shame of being somewhere they don't belong because they're there by accident, and believing that everyone else knows how to behave and belong, but not them. Yeah. And if they belong, it's just because they're pretending. So what is interesting is that sometimes from outside, it's really difficult to imagine that the person can feel as an imposter, because they can be smiling, nodding, and it can feel as like a performance from their side. Also, what people say about experience is that having a belief, the behaviors, the beliefs behind our behaviors and feelings is that there is some lack of importance, something or a skill that everyone else has, but not me. So, and just if something terrible might happen if this deficit, this deficiency will be revealed. So, as I mentioned, this external validation, the unstable self-esteem leads to the constant desire to receive confirmation, to give the right to be where you are, and can become an obsession. So here we are offering, the kind of the thinking that can people have in the head while receiving a compliment for the accomplishment. You are doing great. So what they say versus what you think. The thoughts can be focusing on like, oh no, they only say that because they feel sorry for me. Because they can't mean that. I bet they're already looking for someone to replace me. Not in spite of them saying that you're doing great. No, they only think that because they haven't seen me through enough yet. The thing that I mentioned before is it creates a circle, and external validation on each occasion only temporarily relieves the anxiety, and therefore never lives permanently. Here we come to the perfectionism and to the belief that perfection is something that you can achieve. Spoiler note. So two types of beliefs. One can be, oh, I have a good days, bad days, but overall I'm okay. Versus, okay, if I'm perfect, so then I will be, no one can judge me, no one can say anything to me. In the case of imposter phenomenon. And what is really important to remember that at the end of the day, it reduces the quality of life, and the life is just not as enjoyable or full as it could be because of these negative feelings and striving to perfectionism. And especially when learning is a process in which we are very often finding ourselves in academic environment, because we're always learning something that is, we're dealing with things that we do not know at all. And if you want to do something new, you cannot be perfect immediately. And any new activity or skills that you're trying to gain can easily turn, as a threat to your perfectionism of striving to prove to someone external. And it takes the focus away from value of why you're learning in the first place, why you're investigating in the first place. Sorry, someone wants to comment? No, I guess it was just interference. Example, no? Oh, I want to learn how to write grants. Well, it's a tough task. It never comes easy in the first place. So what can be not very nice thought is like, oh, if I don't write the perfect grant, I'm worthless. It doesn't matter how good am I at other things. So immediately everything is, without value, just because you cannot write the perfect grant. Researchers think, what can be, why this can happen to us, the phenomenon of imposterism. So some say there's some indication that it can relate to the early childhood experience that could devalue the intrinsic worth, the trauma, some environmental conditions. There is kind of association with what is called innate personality traits, like traits of anxiety or neuroticism that make person more predisposed to feel like an imposter. But reflecting on in modern culture, productivity and I can even say neoliberal culture, there is such a link to what you were and how you produce, how you appear. So in academia, this pressure of producing, publishing, no publish or perish, is such strong. So let's look a bit, in academia, what are the factors that exacerbate the feelings. Yeah, before that, let's just, again, think a bit, I'm not saying it's maybe all cultures, but I mean, many modern cultures do place more value on the final product rather than an experience. Well, I didn't mention I have kids, small kids. They're small, so this comment really resonates with me because I recognize myself as a mother. So imagine a kid is playing the piano well. So one comment from parents can be, "Oh, you play so well, then probably you're talented. So let's send you to a musical school for talented children. So then you master your skill, become a famous musician. Envisioning the career in front." But while on the other hand, you just, if you focus on experience, you can keep it more open and highlight, oh, you play the piano so well. Do you enjoy playing it? Would you like to learn more about it? Because I, as a parent, I would support you to choosing to do things you enjoy without focusing on product and, making a career out of it immediately. So in academia, so researchers do study imposter phenomenon through one test that was, the original from 78, the Clance imposter phenomenon scale. I'm putting the link in the case you would like to take a look at it later. Original version was in English and it has been adapted and validated in other languages such as in German, Turkish, Hebrew, and I think recently I saw publications from Chinese researchers on imposter phenomenon in medical students and doctors. So I imagine it was adapted to Chinese. In academia, there are various estimations or measurements depending on the cutoff, depending on the group. So 1/5, 20% of students may suffer from imposter phenomenon already at the university student level. Another report says that specifically looking at female academics, up to 95, well, 95 is almost 100%, may experience moderate or severe symptoms. And what is actually bringing joy to me, for example, as a researcher, that more research is coming on looking, for example, on experience of PhD students, linking it to specific skills that we have, I don't know, like academic writing and the whole concepts of integrity, exploring connections between phenomenon and feelings of being academically unprepared. So hopefully, while more research comes, we can come with better estimates as well. But these numbers are particularly high. So as I said, 95% is almost 100%. It's just imagine that all these people, all of us, just stand nearby each other and everyone thinks, no, it's me that do not deserve to be here. The others, they are perfectly fine and they belong, but we're all together at the end. what are the factors in the culture of academia that may exacerbate the grades that we have from university, that our source of comparing. We're comparing with our peers on the grades. When you enter the PhD program, you're evaluated. Then constantly your research is evaluated as well. And it can be that while you were the best in school, then you can become the worst. As I mentioned, yeah, research is assessed through publications, indexes, and so on and so forth. And it's promoted. It's promoted to compare yourself. Oh, my peers have published so many papers, or even requirement from the supervisor sometimes that say no, like all my PhD students need to publish high-profile papers to graduate. This creates a strong pressure and a certain culture around being academic. Or in order to arrive to that type of output, you need to bring efforts, and efforts are also being compared, because the harder you work, the more you would produce. I don't know, the comment here, all my colleagues work harder than me. I have to work harder than everyone because I'm not as smart as them. This can be a thought. And again, it can be promoted in a not a very positive way from supervisors by comparing that, oh, you do not work on weekends, but my other PhD students work on the weekends. And this is just not helping at all. And the failure, is it a friend or a foe? Because what can happen if there is a sudden failure on my academic path? For example, a comment, well, I thought things were fine, but then I just got destroyed by supervisors during my defense. And especially for PhD students, the figure of supervisor is very important, and needs to be addressed very carefully, the communication, the contract between them. Another peculiarity is about finances, because academic career is very financially unstable, because you have fellowships. In some countries, these fellowships, being a PhD researcher, is not even considered as an employment contract. Therefore, you don't have the social benefits. And the peers who didn't choose this path, they can seem very much more stable. I don't know. For example, a comment, oh, your former classmates already bought a house, and you? And one of the last but not least is the credit, because sometimes giving too much credit to others, not enough to yourself, is not helping you to make your self-esteem stable. For example, a comment, oh, well, nothing I did would have been possible without the constant support of my postdoc. This is a comment probably from a young PhD. So I would say what is important is to remember that if you evaluate only through achievements on the scale, then it will never feel like a solid foundation, especially because in academia, where failure is pretty much part of the job, just because of the nature of what we are dealing with. I'm wondering how are you doing? If there are questions, if you want to take a little break, and also a reminder myself to take a bit of water.
So far it's been quite fantastic, actually. And I do have a couple of questions. That is, firstly, how do we identify that it's imposter phenomenon and not just low self-esteem? And also, do you think people who tend to be a little bit more self-aware might be the ones more likely to have imposter phenomenon later in life? Are those two things in some correlation or the other?
Okay, so you have two questions, no? How to one identifies? Okay. Well, as a researcher, I would suggest maybe first take a test for both. There are
Okay.
self-esteem tests,
Mhm.
and there are tests for imposter phenomenon. What else can I say? That's a good question. Actually, myself, I was I know the feeling of what imposter phenomenon feels like.
Yeah, I think it's a little bit like self-esteem goes in all aspects of your life. Sometimes if you're low on self-esteem, you will be doubting every aspect of your life. Imposter is more to do with how successful you are. I guess it comes more in terms of what your productivity is in society. So that's what I personally experienced, the difference there. But then again, my second question is, if you're more self-aware, would you be more prone to going through IB? Is that something that would um, be a plus point for people who lack self-awareness in that way?
Mm. Well, I think yes and no, just because I'm trying to think, when the person is self-aware, is there like in general, no, like knowing yourself, or there is some negative connotation in this self-aware phrase. I mean, if
No,
I know
like,
myself, I'm aware
mhm,
of my pluses and minuses. I don't know, I just say
yes,
it. I mean, I know how to care about myself. No, it's not necessarily like, okay, I don't believe I'm good enough. So maybe they're like warm and hard, different qualities, but not
okay,
necessarily linked to each other.
okay.
I don't know, maybe someone else has a thought on it.
Yeah, it's
Um,
open to the audience as well if anyone likes to join in on this.
yeah, maybe we can even stop recording or pause recording for a
Yeah,
moment. So
yeah, sure.
does it work? Okay. I hope you see the slide.
Yeah.
So we'll shift a bit now the gears and start speaking not about the individuals, but about the system, and highlighting well, first of all, imposter phenomenon really, after first coining of the term, the self-help industry, the books and the courses in America just flourished, boomed. Even before they had any scientific evidence, just people started to, publish books on how to help, how to deal with imposter phenomenon. So very handy, you know. And this article in Harvard Business Review was very, very interesting in terms of, oops, how to remove this. Okay, it was in 3 years ago, and just the title is so strong. I think to stop telling women they have imposter syndrome. So how much what we are told affects us is really powerful. And this article instead offered a different view. It offered a view that it's not just like it's an illusion of the thinking, oh yes, I'm super successful, but I feel like an imposter. No, the other way around. Just there is a systemic bias and inclusion that makes you feel like you do not belong. So it's more about discrimination rather than being neurotic or anxious per se. And so what Dragonfly Mental Health like in this talk to highlight, to speak about the diversity. And again, there is more and more research slowly coming up that marginalized groups or less represented groups that do not have the voice, they're represented well enough, they do suffer more from mental health issues and things like imposter phenomenon, and which results from kind of all sorts of discrimination. And they can be, in each context and culture can be different groups, but overall we can think of women as a group that is less represented, people of color, LGBTQ plus groups. And first generation scientist is, I think, less spoken, but it's true that there is so-called hidden curriculum in academia, unspoken rules how to make career. So a person who comes from more modest background, the first generation scientists, they do not know these rules, or they do have economic challenges in staying at the same rhythm as those who come from different background. Then disability, so the discrimination or lack of accommodations in terms of accessibility or ableism that is so embedded in many things in the workplaces still. Or international scientists. I myself, I moved many times, and each time when you move, you just zero up your social capital, you have a culture shock, you have language barrier, and it's just, not very nice. Again, I'm putting here different citing talks to say that exactly in the last couple of years, there are more research is done on specific intersectionality and the imposter phenomenon. Of course, a lot of it is in America, so they focus on people of color, Latino, Hispanic relations, but it's really promising and hopeful to see more on that. But I guess the key here is to contextualize the imposter phenomenon not as something that is individual, and then before you need to fix individual because they are neurotic, anxious, and whatever, but rather than focus on the workplace environment that would be welcoming, that would be promoting diversity, and therefore would be helping everyone to not to have the imposter phenomenon. And I've been mentioned through the comments, not from putative supervisors that are kind of were damaging, and indeed, this is another slide with another couple of such comments. A properly trained monkey could do a PhD, or comments, is that really what you have done since our last meeting? So communication is really an important thing, because what people say to us impacts how we then think and react. And the concept of microaggressions, a term that is quite recent, well, it means what it says, microaggression. So the remarks that can seem harmless, but when they're repeated daily and in different aspects of life, then they just accumulate like a snowball and just may serve as a constant reminder to people from marginalized groups that they're less than, that they're not enough, and therefore exacerbating, promoting the imposter syndrome. And here I'll be giving, just a couple of examples. So I'm not saying that such comments always are intentional, but sometimes indeed behind there is a pretty much of insult. I don't know, still, you're too pretty to be a scientist, while, being actually a harassment comment. And this one is from US, or you're just an affirmative action hire, being hired because of the law. Comments about, clothing choices, like, oh, this is so gay. So the more I read, the less harmless they look to me, actually. Cultural communication differences, that, for example, to a person from Asia, while you're complaining, don't Asian people have homework? So there are certain stereotypes about other cultures or about other groups, which do not help to see the person, don't help the communication, and can be really offensive. Or the one again related to the first generation scientists, or for example, to international scientists as well, about assumptions that they can work for free, or do not request our reimbursements. Comments like, "Oh, you should have thought about it before, before pursuing your education." Or accessibility challenges is must, because the comment that is mentioned here, like, "Oh, are you using that wheelchair for sympathy? Because I've seen you walk." And such type of comment is just not acceptable. And for example, now with online, in some communities, we do see that there is efforts to make it accessible through providing visual aids, but not everywhere. And if there is, for example, systemic refusal to provide aids because just one person, well, if one person needs, then it will be helpful for everyone, I'd say. And this slide again reiterates how damaging can be microaggressions for certain groups of people. For example, the immigrants that may have a fear of exile, being excluded. This, I guess, is linking to the experience during early pandemics. And this personal thought I also experienced, like, oh, if something bad happens, my contract will be terminated and I will have to go back home without a degree, and seen as a failure there, or something even more terrible. So as I promised, we can go through list of tips from Dragonfly Mental Health on what helps. And awareness. We spoke about awareness, helps, and acceptance. And I wasn't saying fighting the phenomenon, but actually it's not a good metaphor, because fighting a phenomenon, it means you again putting the gasoline on fire, because you enforce then I can become better, stronger, and comparison with the phenomenon. Dragonfly Mental Health does suggest to consider psychotherapy. It's something really damaging quality of life. Well, research says also coaching can be helpful in dealing with certain aspects of feeling like an imposter. Again, trying to avoid the trap, I'm doing this to become better, or only after this experience I become better and will be deserving to be there. No. Again, awareness is meaning you'll be able to identify your own feelings and make logical interpretation. So recognize the emotions as they arise, evaluate the needs or insecurities behind them, and engage logically. And what I love a lot is this word compassionately, to identify what you actually need. So coming back to the previous question, probably when you're self-aware, then it's like it's a protective factor, because you already had done this part. I was mentioning talking to someone, so connecting to your peers is very important, because when you understand that other people are not perfect, as was mentioned by the very valuable comment, that even those who are supervisors who have been for 30 years in the research in the field, they do not know everything, and it's normal. So when speaking to others, you discover that like many people may feel the exact way. And the principle of sufficiency is the opposite of perfectionism, or principle of ideality. So no such thing as an ideal perfect person, and the feeling of I'm good enough. I'm good enough to do my job. Some skills I'm good at, some not. Just like everyone else. Like, yeah, there are so many techniques. Some I know, some I know better, some I never know, and I will never learn them, because you cannot learn everything, and it's okay. And it's great when this is promoted by team leads, and I hope many of you will become leaders in due course, or maybe you already. So it's important to remember which kind of ideas or culture you send out there. So the summary, what helps, knowing the symptoms and signs is what this talk has delivered to you, knowing that you're not alone. I guess we also share this already. So reminding that you earned your position through, objective fact, stopping to compare the work with others, and trying to accept congratulations with achievements, replacing the perfection with sufficiency, being kind to yourself. Track your successes. This is a bit tricky, because it can maybe at a certain point go again to the comparison. But again, with compassion and kindness, one can track successes in being kind, and occasions in which perfection was replaced with sufficiency. And again, what has been mentioned in the comment, being able to talk to the mentor or PI is really important to understand that the failure or not being able to be perfect is really very common. And consideration to try therapy or coaching. And important, as the symptoms may be really masking, it's worth to check if there's anxiety or depression can be behind it. Again, by taking a questionnaire, talking to a professional. And I think we've done all the slides, and we have 6 minutes or even a bit more for a discussion. I think I'll put this in the chat. I would ask you to fill in the survey afterwards, so it can help us to, improve better in the, we'll become better and we'll be deserving to be here. Okay, bad joke. Okay, I'll
I'll pause the
sharing.
recording for now, I guess.
Yeah. Thank you so much.
Yeah.